to be talking about Medicare Basics. My name is Stephanie Fahuri, and I am the supervising attorney with the Cancer Legal Resource Center. I do want to let you know, and it does say in the chat box, hopefully all of you can see it, the slides and recording of the webinar will be available on our website within the next week or two after the webinar has concluded. So, you know, if you missed something or if you want to share the information with any of your colleagues or friends or family, please feel free to do so. We will make the slides and recording available. So just as a little reminder, I'm sure that many of you probably are already aware of this, but I want to let you know that I will try to leave some time for questions. I hope that I will be able to answer questions at the end of the presentation, but if questions come up that I'm not able to answer, or if you think of something later on, please do feel free to contact our telephone assistance line. It's a national free hotline where you can ask us pretty much any sort of cancer-related legal question, and we can try to provide you with information and resources on those issues. Our phone number is 866-843-2572, so that's 866-THE-CLRC. And then we also have our online intake form at clrcintake.org. And I just want to also remind you that the CLRC is a program of the Disability Rights Legal Center, and all of our services are free and confidential. So today's goals, I want to give you a basic overview of what is Medicare, who is it for, what are the different parts of the program, and when can someone sign up? Because that is certainly an issue that we hear about quite a bit from callers on our telephone assistance line, and also from, you know, people that we meet when we go and do these types of educational workshops out in the community. People want to know, how do I sign up for Medicare? What makes me eligible? What are all of these different parts? It sounds like alphabet soup. So hopefully, once the webinar is over, you'll have a greater understanding of, you know, sort of what these basics of Medicare are. So just to make sure that we are all on the same page, I want to clarify the difference between Medicare and Medicaid, because unfortunately the names of these two programs are very similar, and so a lot of people do get them mixed up. Medicare, which is the program that we are going to be talking about today, is a federal program that is generally for people who are over age 65 or older and who are entitled to Social Security retirement benefits, or for people who are under 65 and have been receiving Social Security disability insurance for 24 months. Now, there are some other ways to also qualify for Medicare, like through Social Security railroad retirement, or through if you have end-stage renal disease. But these are the two main ways that our callers and the people that we talk to qualify for Medicare. So you either turn 65 or you've been receiving SSDI benefits for 24 months. So the other program that people sometimes get a little confused by is Medicaid. And so Medicaid is a federal and state-run program. It's different in every state, and it's generally for people who have limited income and then, depending on their situation, maybe also have limited resources. So that means limited assets. They don't have that much money in the bank, maybe don't own much by way of property. So before the Affordable Care Act was passed, there were generally, only a few ways to be qualified for Medicaid in most states. So you had to have low income and low assets or limited resources. And then for a lot of people with cancer who we talk to, they would qualify for Medicaid as part of the aged, blind, and disabled program. So you had to, pretty much have a disability as determined by the Social Security Administration in order to be eligible. It wasn't just an issue of, okay, you have low income and low limited resources. Now that the Affordable Care Act has been more fully implemented, there are many states that have expanded their Medicaid programs to include people who are under a certain income level who have to also have, be a part of the aged, blind, and disabled program. So I just want to, I'm not going to go into too much more detail about Medicaid, but I just want to clarify the difference. So Medicare, age 65 or older, or you're under 65 and you've been on SSDI for 24 months, versus Medicaid, which is really based on income and then potentially also on whether or not you're disabled, and maybe they might also look at your resources or assets. And so this is a chart. It's a little bit outdated now. It is from 2013. But I just wanted to show it to sort of give you an idea of what the characteristics are of the Medicare population. So as you can see from the chart, more than 65%, or about 65% of people who have Medicare or who are on Medicare have at least 3 chronic conditions, and about 50% have income that's below $23,500 per year. 16% of the Medicare population is under 65 and disabled. So, those are those people who are qualifying based on Social Security disability for at least 2 years. So, I just wanted to give you sort of an idea of what the population is that we're talking about. Maybe some of these things apply to you or to your patients. Sort of gives you an idea of who's signing up for this program or who's eligible and who's enrolled. So, we hear a lot when we're talking about Medicare about all these different parts. There's Part A, Part B, Part C, Part D. So I'm going to try to break it down here a little bit and talk about each of these parts and what they mean and sort of what they get you. So Medicare does have 4 parts. Part A is hospital insurance. And so what that means is it basically covers inpatient hospital care. It often covers skilled nursing facility care, and then also some home health care and hospice care. So, there are certain different requirements for each of those things to be covered, but it essentially is your hospital insurance that covers inpatient stays. So Part B is sort of what we think of when we're talking about medical insurance. So Part B is what covers physician services. It covers outpatient hospital services, also things like x-rays, lab tests, cancer screenings, some medical supplies and services. So this is a little bit more, Part A is for when you're in the hospital. Part B covers your doctor's visits generally. And there have been some changes to Part B since the Affordable Care Act was passed. Previously, Medicare only covered maybe an initial visit with a doctor when you first signed up for Medicare, and then you were sort of just on your own until you got sick and had to go back to the doctor. One of the things that has changed is that now Medicare beneficiaries are entitled to a free annual wellness exam. And in addition to that, Medicare has also started to cover certain preventive services without having to pay a copay or meet your deductible. So just like other insurance policies, Medicare does have some copays and deductibles and monthly premiums, and I'll talk a little bit more about the costs in a few minutes, but there are now certain preventive services that are covered without having to meet that deductible or pay those copays. And so this is just a list of some of those preventive services. You can also look at your Medicare and You guide that will maybe go into a little bit more detail. And the Medicare and You guide, I believe they issue a new one every year, and it is really comprehensive. It's a really good place to start if you're trying to figure out what your Medicare coverage is, or what the different options are. So Part C is basically, it's called Part C, or it's called Medicare Advantage plans. You might have heard both. They're sort of interchangeable. But what Medicare Part C is rather than having Part A separately, Part B separately, and Part D separately, which we'll talk about in a second, it's all of those things combined into one, so that it's basically an HMO or a PPO similar to maybe the type of private health insurance that a person had while they were, still working, having a group plan under their employer or under a spouse's employer. So it's Part A, B, and D together. It has to provide all Medicare covered services. And there are usually some set co-payments to see doctors, but the way that Medicare Advantage plans really work is, you sign up for an HMO or PPO. There are different, some examples would be maybe through Kaiser or through Health Net or Blue Shield or Aetna. The Medicare Advantage plans vary depending on your location. So even though Medicare is a federal program, which means that it doesn't matter what state you live in, you can sign up for Medicare as long as you're eligible and go see Medicare doctors. If you're in a Medicare Advantage plan, it's going to be similar to, if you were in another HMO or PPO in your area, you'd have to go see in-network doctors, essentially. So, some people like the Medicare Advantage plans. I've heard great things in California here. I hear either great things or terrible things about Kaiser, but, that's just one example of a Medicare Advantage plan. And so if you're curious about Advantage plans, you can certainly look and see which types of plans are available in your area. And so Part D is the prescription drug benefit. And so if you have a Medicare Advantage plan, this would be included as part of that. Otherwise, if you have Parts A and B separately, you would have to separately sign up for a prescription drug plan as well, assuming you wanted prescription drug coverage, which most likely I assume that you probably would. So what does Part D actually cover? Well, it does have to cover cancer medications, HIV/AIDS treatments, antidepressants, anticonvulsant treatments for epilepsy and other conditions, immunosuppressant drugs. So it does cover a fair amount of, the medications that potentially you might need. There are, varying drug plans, so it is a good idea to shop around and look at what the different options are, especially if you know what types of medications you're already on or are going to need long term. You can try to, compare and contrast some of the prices, because the monthly premiums might be different, or they might use different pharmacies, so it's certainly a good idea to sort of shop around if you can. And just as a note, oral chemotherapy drugs and anti-nausea drugs have been covered since 1999. So in case you were curious about oral chemotherapy, it is potentially covered. So how does Part D work? You have to, like I said, you have to choose a prescription drug plan. They're not all the same. They do have different formularies, premiums and copays, and different pharmacies. So I sort of mentioned that already. But just to break that down a little bit more, in case you've never heard the term formulary, a formulary is basically the list that a prescription drug plan has that says these drugs are covered, these drugs are maybe not covered. So if something is on the formulary, that means it is potentially covered. But then even within the formulary, there are different tiers. So when you're looking at a prescription drug plan, it might be good to inquire, especially if you know about a specific drug that you're going to need to be taking, it's a good idea to inquire, what tier is this on, if it's on the formulary? Because a tier 1 drug is probably going to be paid for or reimbursed at a much higher rate than something that's further down, like tier 1, tier 2, tier 2 or tier 3. So, you know, the different drug plans might have different formularies. You might see that, okay, on this one formulary, drug is not on this other formulary, so you might choose one plan over the other for that reason. Like I said, also there might be different premiums and copays. Some drug plans might say, hey, you only have a $10 copay for this one drug. Maybe another one would have a $20 copay. So if it's a good idea to shop around, make sure that you are as informed as you can be before you choose one of these, because as we'll see in a couple of minutes, there are only certain times during the year where you might be able to switch your plan. So, you know, if you can plan ahead as well as you can, hopefully you won't get into a situation where you're desperate to switch because the pharmacy that you've been going to for the last 20 years is actually not part of your Medicare Part D plan. So, you know, shop around. That's always sound advice, I would say. Now, the one last thing that I do want to mention about Medicare Part D is the donut hole. If you're not familiar with the Medicare Part D donut hole, please try not to worry about it too much. If you would like a greater explanation of the donut hole, please feel free to contact our telephone assistance line. I'm not going to go into too much detail about it right now. But essentially what happens is once you and your plan have spent a certain amount of money on prescription drugs, you reach something called the coverage gap, or the donut hole. Once you are at that point, well, before the Affordable Care Act was passed, once you reach that point, you were essentially required to pay basically the whole cost of your prescription drugs while you were in that coverage gap. And then once you had shelled out a certain amount of money in addition to that, that's when Medicare would kick back in and start paying for parts of your drugs again. But essentially there was a pretty significant amount of money that you had to pay, several thousands of dollars, before Medicare would come back in. So because of the Affordable Care Act, by 2020, once you reach the coverage gap, you will only be required to pay 25% of the costs of brand name or generic drugs. Right now it's 2015, so those figures are 45. You're currently paying 45% for brand name drugs or 65% for generic drugs. And just in case you're curious about why it seems to be that percentage is so much higher for the generic drugs, it's because generic drugs are generally less expensive. So even if it says, 65% of the cost for generic drugs, that still might be significantly less actual money than if you are paying 45% than 45% of the cost of a brand name drug. So hopefully this will help to ease some of the burdens for Medicare beneficiaries who have Part D, who have expensive medications, and are potentially facing this coverage gap. The goal is to, hopefully make some of these prescription drugs more affordable for people who have to pay for them. So if you're trying to figure out, okay, what are my coverage choices? Because we've just gone over parts A, B, C, and D, but how do they all work together? So step one, decide how you want to get your coverage. So the column on the left, original Medicare, that would be where you have Part A, hospital insurance, Part B, medical insurance, And then step 2, you decide whether or not you want to add prescription drug coverage. Most likely you probably do, because you probably need to have prescription drug access at some point. So then you'd also potentially opt into Part D. And then you'd have to decide if you want supplemental coverage. So supplemental coverage, also known as Medicare Supplement Insurance or Medigap plans. I'll talk a little bit more about those in a minute, but generally speaking, people who sign up for original Medicare, so they have these, different parts all sort of separate, but that means that you can go to pretty much any doctor or hospital that accepts Medicare. Because original Medicare, because Parts A, B, and potentially D only generally they only generally pay for 80% of the healthcare costs of the beneficiary. That means that that person who has Part A or Part B would then be responsible for paying that additional 20%. That's where supplemental coverage comes into play. So basically, if you decide to go with original Medicare, it's usually pretty important to sign up for supplemental coverage immediately, because otherwise, if you all of a sudden get sick and you have $100,000 worth of hospital expenses and Medicare says, oh, we'll pay our 80%. We'll pay $80,000, that means that you're still potentially on the hook for that extra $20,000, which might have otherwise been covered if you'd had a supplemental plan. But I'll go into a little bit more detail about that once we get to there later in the presentation. So you've got the one option, original Medicare with a supplemental plan, or you can sign up for a Medicare Advantage plan, like an HMO or PPO. So that's Part C, which combines Part A, Part B, and usually Part D. And if you sign up for a Medicare Advantage plan, you do not need and actually cannot purchase a Medigap policy, because Medicare Advantage plans have a different reimbursement rate. It really is more like an HMO or PPO that people might be used to under, whatever type of insurance they had previously. So original Medicare or Medicare Advantage plan, it's really up to you to look at what the different options are and make the choice that is going to make the most sense for you and for your medical condition. So, obviously, none of this is completely free. I think that sometimes people are under the impression that Medicare is free because it's a government program, but that's not necessarily the case, and it's actually not entirely the case at all when it comes to different parts of Medicare coverage. So for Medicare Part A, which is the hospital insurance, to remain on Medicare Part A. So, and this is true for most people as long as you have enough work history and you've paid into Social Security. So for most people who are eligible for Social Security retirement benefits, Part A is free on a monthly basis. If you have insufficient or no Social Security work history, the Part A monthly premium for 2015 is $406 a month. But like I said, that doesn't apply to most people as long as you've been paying into Social Security throughout your work history. As long as you have enough work credits, the monthly premiums are free. However, there are copays and potential coinsurance that is not free. So it's a good idea to, check out what your Part A coverage actually entails so that you don't just assume that any hospital stay is going to be 100% free and that you will not owe any money. Okay, so for Part B, it's a little bit different. Part B, for people who either as a single person earns less than $85,000 per year, or if you are married and filing jointly, then or up to $170,000 per year, then your monthly premiums for Part B are $104.90. That's for 2015. The annual deductible is $147 a month, or sorry, a year. And then, you know, to determine whether or not you'd have to pay higher premiums for Part B, so if you make $100,000 a year, or if you're a couple making more than $170,000 a year, the Social Security Administration uses your most recent federal tax return to determine whether or not you might have to pay higher premiums. So, you know, if you're facing that situation and you have additional questions, you can certainly contact us. But for most of the people that we talk to, the monthly premiums are about $105. And if you're receiving Social Security Disability Insurance, SSDI, or if you're receiving Social Security retirement benefits, those premiums are usually automatically deducted from your Social Security benefits. If, on the other hand, you are, let's say you turn 65 and you're still working, but you're not ready to retire, so you're not receiving your retirement benefits, but you do sign up for Medicare, you'd have to make sure that you pay those monthly premiums, since you wouldn't be receiving a check that they could be deducted from. For Part C, the amount of the monthly premium is going to depend on the type of plan that you choose. So it's not just oh, everyone who signs up for a Medicare Advantage plan pays X number of dollars. There are different plans that, you know, have different premium costs, and you know, they cover different things. So again, it's important to sort of shop around and see which plan might make the most sense for you, which one might be affordable for you, or maybe you just want to stick with original Medicare. And keep in mind too that, you know, this is for Part B, the monthly premium is about $105. But if you have Part B, you're probably also purchasing a Part D plan, which is going to have a premium, and it says, you know, the average premium is about $30 a month. And then, because you're probably also going to want to buy a Medigap or supplemental plan, you're also going to be paying a monthly premium for that. So if you're shopping around and it looks like the Medicare Advantage plan premiums are kind of high, just remember that, you know, you're not also purchasing a supplemental plan if you're doing a Medicare Advantage plan. So you can compare the costs sort of that way. So if you're having trouble paying some of your Medicare premiums, especially with Part D, you might be eligible for something called extra help. There are income and resource limits, and the resources include your savings and stocks, but they don't take into account a home and a car. So if you're curious about, you know, some of the costs that you're facing and sort of struggling to make ends meet and continue to pay all of your premiums, you might want to contact the Social Security Administration to see whether or not it's possible that you might be eligible for this extra help program. So yeah, in order to qualify for extra help, a person has to be receiving Medicare, have limited resources and income, and then you have to live within the United States or the District of Columbia. Okay, so now that we've got a basic understanding of what the different parts are and what they each potentially cover, how do you actually apply for Medicare? When can you sign up? Well, you will be automatically enrolled in Medicare Part A effective the month you turn 65. So if you turned 65 on October 25th, 2014, your Medicare effective date would be October 1st of 2014. So it's the first of the month of your 65th birthday. If you are becoming eligible for Medicare not because you turned 65, but because you are receiving SSDI, then it would be a little bit different, which is on the next slide here. So if you're under 65 and receiving SSDI, you should enroll during the 7-month period that starts 3 months before your 25th month of getting Social Security disability benefits and ends 3 months after your 25th month of getting disability benefits. So, for example, if we go back here, you're basically eligible to sign up for Medicare during the 7-month period that surrounds your 65th birthday. So the month of your 65th birthday, and then the 3 months before, and the 3 months after. If instead you are receiving SSDI, it's that, the month that would be your the 25th month of receiving Social Security benefits, and also the 3 months before and the 3 months after. So you have this initial enrollment period where you can sign up. It's a 7-month period, regardless of either, you're turning 65 or you're, turning your 25th month of receiving SSDI. It's a 7-month period, and that's called your initial enrollment period. If, for whatever reason, you miss your initial enrollment period, there is a general enrollment period each year to sign up for Medicare Parts A and B. So this part here doesn't really apply to Medicare Advantage plans. Medicare Advantage plans still have that same initial enrollment period, so for anything having to do with Medicare, you can sign up during those 7 months surrounding your 65th birthday or the 7 months surrounding when you have been receiving SSDI for 2 years. For Parts A and B, there is a general enrollment period between January 1st and March 31st each year. So if you didn't sign up for Part A or Part B when you were first eligible, and if you're not eligible for a special enrollment period, which I'll talk about in a second, you can sign up during the general enrollment period from January 1st to March 31st each year. Unfortunately, if you do have to wait for general enrollment, your coverage does not begin until July 1st. So there's a good reason not to wait around for general enrollment, especially if you potentially have a serious health condition, if you have cancer, if you might need to go back for cancer screenings or checkups, because if something happens in December and you can't even sign up until January 1st, and then your coverage doesn't even begin until July, who knows what could happen in those 6 months while you're waiting to get coverage. So, for a lot of people, it really makes sense to sign up during initial enrollment unless they know for certain that they will be eligible for a special enrollment period so that they wouldn't have to wait for coverage. We've definitely had people call us on our telephone assistance line with this specific issue where they said, oh, I didn't think I needed to sign up for Medicare. I had no idea that it was going to be hard for me to sign up later. I learned about the general enrollment period, but why doesn't my coverage start till July? What am I supposed to do in the meantime? If you can try to avoid that situation, it's probably better for everyone, especially if you really need healthcare treatment. So if you didn't sign up during initial enrollment, and you really don't want to wait for general enrollment, it's possible that you might be eligible for something called a special enrollment period. So once your initial enrollment period ends, you might have the chance to sign up for Medicare during a special enrollment period. So if you're covered under a group health plan based on current employment, you might have a special enrollment period to sign up for Part A and or Part B anytime, as long as you or your spouse is working and you're covered by a group health plan through the employer or union based on that work. You also have an 8-month special enrollment period to sign up for Parts A or B that starts a month after the employment ends or the group health plan insurance based on current employment ends, whichever happens first. And then you usually don't have to pay a late enrollment penalty if you sign up during a special enrollment period. And I'll go over the penalties a little bit more as well. But basically, as you can see, it's really only very specific situations where you or your spouse are still currently employed where you might be able to qualify for a special enrollment period. So, as I mentioned before, for most people, it makes the most sense to sign during the initial enrollment period, and then you don't have to worry about, oh, well, what's going to happen if I can't keep working, or what's going to happen if I need to go to the doctor. You know, it'll be out of the way and you won't have to worry about penalties or anything like that. So, you know, we just talked about enrollment periods for Parts A and B. What if you have a Medicare Advantage plan, or what if you want to sign up for a Medicare Advantage plan? Well, obviously, if you want to initially sign up for a Medicare Advantage plan, you certainly can do that during your initial enrollment period for Medicare. So again, those 7 months surrounding your 65th birthday, or surrounding the time that you have received Social Security disability benefits for at least 2 years. But if you're already enrolled in a Medicare Advantage plan, or if you want to switch to a Medicare Advantage plan, or if you want to change from Medicare Advantage back to original Medicare, you know, switch plans, or if you want to switch from a plan that doesn't offer drug coverage to one that does, or if you want to join a Medicare prescription drug plan, these are the things that you would have to do during open enrollment, which has already begun. Obviously, today is October 21st, and it began on October 15th and goes through December 7th. And so these dates are the same every year, as far as I have been able to tell. October 15th through December 7th. That's when it's open enrollment for you to switch your plans from, like I said, original to an Advantage plan, from an Advantage plan back to original. You can switch your plans around, but it does have to be during open enrollment. So if you realize in June that, you know what, I really want to go see this one doctor, he's not part of my HMO's network, that means you might have to wait until October to be able to make that change. So there are some incentives to sign up for Medicare as soon as you are eligible. Those incentives are basically not to be penalized. So there are penalties for late enrollment. And I think part of that probably has to do with the idea that if you sign up right when you're 65, you might be less likely to be ill, rather than if you wait until you're 70 or 75, maybe there's a greater chance that your healthcare costs will cost even more. So they want, you know, as young as possible, I suppose, people paying into Medicare so that they're, you know, not just signing up once they get sick. So for Part B, if you enroll late, you will have a penalty of 10% of the monthly premiums for the year that you should have signed up, multiplied by the number of years that you were late in signing up, and that amount gets added to your monthly premium for the rest of your life. So for example, if you were eligible for Medicare Part B in 2011, but you didn't sign up until 2013. In 2011, the Part B premium was $96.40 per month, so times 4 is $9.64. If you waited 2 years to sign up, that means, so 2 times $9.64 is $19.28. So that means $19.28 would be added to your monthly Part B premium for life. So it's extremely punitive. It's a pretty big penalty if you think about that. If you wait 2 years, you're going to have to pay an extra $20 potentially or more per month for the rest of your life. That's a lot of money to spend. So again, with Medicare Part B, as I mentioned before, for special enrollment periods, they really are one of the only ways to avoid paying a penalty if you sign up late. So you really, really, really want to be sure that you actually are going to qualify for a special enrollment period before you decide to decline Medicare coverage when you initially become eligible. So I sort of already went over this. If you have additional questions about special enrollment periods, you can certainly contact us. And again, if you are still covered under an employer group plan when you turn 65, if you at that point do decide to join Medicare and accept your Medicare coverage, usually the group plan through work stays your primary insurance, and then Medicare becomes your secondary insurance. So anything that maybe your group plan wouldn't cover, if it's covered under Medicare, Medicare might chip in at that point. So that's another thing to keep in mind too, is that if you do have other coverage, it will depend sometimes if you're still actively working versus if you are retired and you have retirement benefits through your, retirement health benefits through your previous employer. Sometimes Medicare becomes the primary insurance and your group plan becomes secondary. So, I think a lot of that information is outlined in the Medicare and You booklet. And if you have questions, you can certainly always contact your plan administrator, or you can certainly contact some of the resources that I'll share with you who can always answer Medicare questions, and that includes us as well. So for Part D, there are also penalties for late enrollment. If you enroll late in a Medicare Part D plan, the penalty is 1% of the average national premium for the year that you join, multiplied by the full number of months you were eligible to join a Medicare drug plan but did not, and then that amount is added each month to your Medicare Part D premium. So it's not quite as much as the Part B penalty, but it still is a penalty that exists. So, if you'd like to avoid spending unnecessary money, potentially it's a good idea for you to sign up when you initially become eligible. So we talked about this too a little bit earlier, but how do you choose a plan? And this applies to, it says Medicare Part D on this slide, but it really applies to all of the different options that you have. You have to determine what matters most to you. Do you have a serious health condition? Do you think that you might get one? I mean, obviously nobody really ever thinks or hopes that they'll get one, but it's a good idea to take some of your risks into account when you're thinking about, okay, do I want to purchase a plan that's going to cost me, as little as possible on a monthly basis because I really don't have the funds to pay for more, but then maybe it doesn't cover quite as much once you actually do have to access health services? Or do you care more about the convenience or who's covered? Maybe you've been seeing a doctor through your HealthNet plan for the last several years. Now you're switching over to Medicare. Maybe you want to make sure that that doctor is still accepts your type of insurance. And there's always going to be maybe some changes that have to take place when you switch from a private plan over to Medicare, but many doctors do accept Medicare, so that's one more way that you can really do your job, looking to make sure that you're purchasing or selecting the plan that really makes the most sense for you. Because I think that's something that we hear a lot, that when someone finds a doctor that they really like, or they've been going to that doctor for years and years and years, it can be really hard to make a transition to a new oncologist or to a new therapist or to a new whatever. So, checking with your doctor first of all to see, okay, what type of insurance do you accept? Do you accept Medicare? Are you part of a Medicare Advantage plan, or do you just accept, Part B? That's certainly a place that I would start if I was trying to make the decision which type of Medicare I wanted to sign up for. And then, of course, convenience. Some people love the idea of an HMO like Kaiser, where everything's all in one building, or like 2 or 3 buildings all next to each other. Maybe you don't want to have to drive from one hospital to another doctor's office, all across town, or whatever. You want something that's just going to be really convenient and, have everything sort of coordinated. So that's certainly also something to keep in mind, both with respect to where the doctors and hospitals are located, but also the pharmacies. I'm sure some drug plans maybe have mail order prescription drugs. Maybe that's something that you prefer versus having to actually drive or, get someone to take you to the pharmacy. So these are just some things to keep in mind. And then I sort of already went over some of the stuff here about Medigap policies, but I just want to make it clear what exactly they are and why they might be necessary. So a Medigap plan, or a Medicare supplemental insurance, when you enroll in original Medicare, so that's parts A and B and potentially D, you're most likely going to want to sign up for a Medigap policy at the same time. Original Medicare, as I mentioned, only covers about 80% of healthcare costs. So it helps, a Medigap plan would help pay for costs that original Medicare doesn't cover. If you have a Medicare Advantage plan, you can't use a Medigap policy to cover deductibles, copay, or coinsurance costs. So, like I said, this really only applies if you're selecting original Medicare. And the other thing to keep in mind is that in the scenario I gave earlier, where maybe you already have some sort of health insurance retirement benefits through a previous job, that might actually serve as your supplemental insurance. If they say when you retire, hey, you've got this Blue Cross Blue Shield plan through the state of Michigan for the rest of your life, usually what will happen in that scenario is that plan becomes your supplemental insurance and Medicare becomes the primary payer. So, you really want to look into these Medigap policies when you initially sign up for coverage, because they are not, unfortunately, covered by the really important provision in the Affordable Care Act that bars health insurance companies from turning people down based on pre-existing conditions unless you are signing up during your initial enrollment period. So if you wait, like I said, if the most critical time is that initial enrollment period. During that period, you can buy any Medigap policy that you want, and the insurer cannot turn you down or charge you more than anyone else your age, even if you have pre-existing conditions. If instead you wait and don't sign up, run into the issue where you have these, crazy medical bills and are potentially unable to pay them. And then if you try to buy a Medigap plan later, they might say that they're going to charge you more or make you wait because you have pre-existing conditions. So to avoid that and to avoid a lot of these, the penalties and some of the other issues you can run into, for a lot of people, it's a really good idea to sign up for Medicare when they initially become eligible. And if that's something that you want to do or not something that you think you need to do, I highly recommend that you really research the issues and talk to some of the resources that we have here to make sure that you can make Medicare work the way you want it to, so that you're not faced with really scary bills or an inability to get care when you need it. So where to go for help? Well, if you're already enrolled, call your plan first. That's usually, that's what we tell people for private insurance as well. If there's an issue that you're facing, sometimes just figuring out over the phone with a representative can be helpful. You can also read your Medicare and You 2015 booklet. It's also available online on the Medicare website, so if you lost your copy or if you didn't receive a copy, you can certainly look on their website, and they have a lot of really good educational materials. The other thing that I really want to flag for people who have questions about Medicare is your state health insurance assistance program. Every single state has a resource. It's usually called either the SHIP or HICAP office. SHIP is S-H-I-P as in Paul, Senior Health Insurance Program, or HICAP, which is Health Insurance Counseling and Advocacy Program. Every single state has an agency or some department that is specifically dedicated to answering questions about Medicare. If you're not sure, a phone number or how exactly to get that information, you can certainly contact us, and we can provide you with that contact information. It's also available, like I said, on the Medicare.gov website, where you can look and see where you can get additional assistance. And then, of course, you can also contact the Centers for Medicare and Medicaid Services on Medicare.gov. So, as I mentioned, for more information, you can always contact the Cancer Legal Resource Center. Our website is cancerlegalresourcecenter.org. You can also give us a call at 866-CLRC.